On that note, I'd love to introduce Kim Zocker, the CEO of Comprehensive Life Resources.
Thank you. Thank you. Thanks for having us today. I definitely also want to echo Katrina's thanks to Senator Stabenow and Senator Cantwell. They have been champions we have watched from afar. We have taken this leap of faith with them to transform the behavioral health system. I also want to thank Katrina. Like Sound, Comprehensive's roots go back to that late 60s bill from then President Kennedy, and really a determination to provide comprehensive behavioral health care for our folks with mental illness in the community. And we're really proud to join them as members of the Washington Behavioral Health Council. Also, like Katrina, my roots go back to being a young therapist at a community behavioral health center down in Tacoma in a group home back in the late 90s. I've been really honored to work at Comprehensive and to really steer our agency into more modern, deliberate behavioral health care. We received our first expansion grant in 2020, which was quite a ride during the pandemic, but we are now 3 years in, and I want to share a little bit of what we've learned. The first thing we've learned is that CCBHC is not a grant and it's not a program. It is a radical transformation of how we deliver care, and nothing less than that will meet the moment. So this is a restructuring of how we see behavioral health care. My agency has provided over 500 primary care visits in the last 3 years. That's behavioral health care. We have adopted rigorous data-driven quality systems that allow us to get people in for psychiatric services in a week. The work that we do is guided by data and input from our clients, and it looks different than what you're used to. It's not building capacity in behavioral health is not just going to mean more of those typical clinical hours with a therapist that we might all think about from movies and TV. It's going to mean nurses going out into the community to see how somebody's doing with their hypertension, because we know that hypertension and depression can be comorbid together. It's really understanding what somebody needs to stay healthy, and it's transformative. We've taken this leap of faith with Sound, and 16 agencies here in Washington that have taken the invitation up that our senators have and our SAMHSA folks have invited us to be part of this journey. We've taken them up on it. One of the things we need next is to make this fully present in Washington. Washington has a lot of centers of excellence. These programs are really great, and we hear about them. You probably hear about them in the news. I do too. I'm impressed with them. But CCBHC says, let's scale and spread that. Let's take that so everybody in the state has the same possibility of access for these services. And it lets us, as individual communities, like Katrina talked about, do assessments and tell us what our unique community needs. So it's this combination of a rigorous data-driven system that says this is the best practice for behavioral health, and it says every community looks a little different, and so we have the ability to do this a little bit different. So we're hoping, all of us together, our agencies, and with our partnerships with our federal partners and leaders, is that Washington State can come fully into this model. Our state healthcare authority is excited about this. Our state senators and representatives are excited about this, and we hope that we're standing in front of you in a few more years telling you about the change and transformation in our system.